Hi, this is Shelley Kraft, and welcome to SNNLive. We're here at the Biotech Showcase 2012, and we're in San Francisco. I have Asad Zaidi of Epinex Diagnostics, Inc., a private company. Asad, welcome to SNNLive.
Thank you very much for having me over here. It's really a pleasure.
It's good to have you.
Thank
now,
you.
you're a presenting company here.
Yes.
But for our audience, please tell us, what does Epinex do?
Epinex is a biotech-based diagnostic company, and we are making a test that is going to change how the diabetes is screened, diagnosed, and monitored. And it will change the way that the diabetes, the way currently it's being monitored, and we are going to have this test for all the diabetics where they will only have to prick their fingers once a month. It is a revolutionary idea, and we have discovered a biomarker that will allow the diabetics to know how much their protein or their albumin is damaged over the period of last 25 days, and they will be able to not only maintain how their diabetes is doing on a monthly basis, it would be just like a monthly report card for your diabetic health.
So is this for type 2, I take it?
Yes, this is for type 2 diabetics, where majority of diabetics are type 2, almost 95%, and currently there are going to be about almost 500 million people in next 10 years suffering from diabetes. It is a test that is going to be available to the doctors and also to the people in the pharmacy, and they will be able to go buy it with a little tester and see themselves once a month how well they are doing in their diabetes management.
I have diabetes.
Oh, you do?
So let's ask ourselves a question.
Sure.
I now take my blood on most type 2
Daily
people
basis, yes.
on a daily,
Yes.
So and sometimes you feel better, sometimes you feel worse on some days. So how do you not check your blood on a daily basis if you're feeling a different level of health?
Correct. Daily blood glucose testing only tells you how much sugar you have. But why do you want to test your sugar? Because you have some sort of an inference that higher the sugar level, some kind of complication is going on. Our test actually tests the complication that is going on. We monitor glycated albumin, which is a part of your most abundant protein in the body called albumin, and how much the albumin is damaged, we are going to be able to tell you that. So on a monthly basis, you will be able to know how much albumin is damaged, and that is a better information for you to just know what is the glucose level. And currently there is no test like that available, to the doctors or to the general public. And that is what we are working on.
Now, you don't mind me asking you these intense questions.
No, not at all.
So if you're eating a certain way and then you eat the wrong way, and you have a reaction to what you've eaten, then you have to have some way of reversing what you did. So how do you do that?
Correct.
Then?
What are you going to do with that information? That's the most important question, okay? It is almost like your credit report on a monthly basis. You would know whether you were in green, orange, or red level. If you are inching from orange to red, there is something wrong that you are doing, and you need to reverse that. And for type 2 diabetics, I assume you are type 2 diabetic.
Yes.
The most important thing is to change your lifestyle or monitor your drug intake or pharmaceutical intervention. Earlier you know what you are doing on a monthly basis, the better it is for you to be able to manage what kind of food you are eating, whether you need to exercise or you need to go to the doctor. And currently the methods that are being used are obviously not helping people. Otherwise we would not have over 500 million people suffering from diabetes.
So in other words, type 2 diabetes is actually reversible.
Well, in a way, if it is not reversible, at least it is containable. You can. It is a sort of a lifestyle disease. You can manage it. You can control it. You can screen for it at a very early stage. What the biggest problem right now is that majority of the type 2 diabetics, by the time they know that they have diabetes, they're what they call A1C level, which you go to the doctor and they do it. By the time your A1C level is high, almost 90% of your beta cells are dead. So the idea is for you to be able to
Early detection.
detect it early and manage it early, so you probably would not even have to go to the medicine route if you can manage it just doing better changes in your lifestyle.
What is your background?
I am a biochemist and a biomedical engineer. I worked on medical devices such as developing artificial heart valve. If you remember Jarvik 7 heart, the valves that went into the Jarvik 7 heart are the ones that I designed. So I've been involved in developing biomedical devices for a very long time, such as artificial lung, artificial kidneys, and even artificial coronary arteries. So I have seen at from a real operating room level how the diabetes complications are, because majority of the heart diseases and your blindness and neuropathy is all complications of diabetes. So if you can arrest it at an early stage, you won't have to go to that level.
Very interesting, ladies and gentlemen. What is your website?
It's www.epinex.com, and people can get an amazing amount of information from our website, what it is we are doing. We are a private company. We are showing ourselves in this conference for the first time. We have raised our own money, and now we are looking for a larger institutional round. We have been around about 8 years now, 8-9 years in operation, and we have done our own research and built our own product from ground up.
I don't know about you, but I'm going to that website, Epinex, EPINEX.com.
Correct.
I'll be there right off camera. Thanks for coming on.
Thank you very much.
My pleasure to have you.
Thank you very much.